From a reproductive point of view, more dampness in the pelvic space is often related to inflammation and some type of underlying immune pattern going on. This is also where the vaginal microbiome comes into play. So I think someone said that they had some vaginal microbiome challenges that can definitely impact fertility, and it is often rooted in some form of dampness. I want to go through each of these, and we're going to spend some time here so you can really start to identify where you're at. And we'll go from there. So I want to be sure that we have a good baseline understanding of this knowledge and information. So let's start from the top. So with kidney deficiencies, if you're here having a fertility challenge for some period of time, you likely have some underlying kidney deficiency. So sometimes that's more kidney yin deficiency, and sometimes that's more kidney yang deficiency. And this becomes important because when we get to the herbal section, you will need to identify which pattern you're most aligned with, right? And some of you are going to want to take notes, and that's totally valid. Some of you are just going to receive this and then maybe come back and listen again. Both are okay. So with kidney yin deficiency, that looks more like a short follicular phase. It could be an overall short cycle. It could be a menstrual cycle that is either very light or tends to be heavy and bright red. Both of those could be kidney yin deficiency. Another really key element of kidney yin deficiency is like either hot flashes or night sweating or kind of just a general fatigue feeling that doesn't really get better when you rest. And it can include low back pain or just like low back discomfort, especially when bleeding. And then the tongue of kidney yin deficiency it would have like a thin or no coating, so not a lot of coating on the tongue. And the overall shape of the tongue would be thin and slightly red. Whereas kidney yang deficiency, the tongue is going to be puffy, pale, and with usually a white coating because there's not yang. So when there's not yang to move energy through the system, we get like a lot of stuck fluids and dampness accumulating. Because the kidney yang is what supplies the spleen and the stomach with their yang that's needed for digestion. Another key aspect of kidney yang deficiency is that it will often be related to a progesterone deficiency. So it will often come with some luteal phase issue. And so then you really know like, oh yeah, I need to focus on kidney yang. With spleen and stomach disharmony, so that's usually a deficiency, although there can be some excess in the stomach, but usually it's like what I see most often is spleen qi deficiency. So that looks like lots of different digestive stuff. So that could be gas, bloating, constipation, diarrhea. Low appetite is another big one. So like kind of getting into metabolism and how your overall metabolic rate is. This could look like acid reflux. It could look like really just generally irregular eating habits even. That creates a spleen qi issue. So that's another area that a lot of women do need support with. So we'll be going into exactly what to do there. The liver qi stagnation, since the liver is what regulates the cycle. So if you have liver qi stagnation, you might have a longer cycle. You might have pain with your period. You might have endometriosis, fibroids. Really, this is parallel with estrogen dominance or estrogen being too much in relationship to how much progesterone you're making. So here we really focus on like how to support the liver, how to support estrogen elimination. the damp phlegm accumulation really goes along with the spleen and stomach disharmony, because if the spleen is not doing its job for long enough, what happens is you accumulate this dampness. So dampness is like kind of turbidity. It can be yeast or SIBO, small intestine bacterial overgrowth. It can be dysbiosis in the microbiome, but it can also be at the level of connective tissue. So it can also be like adhesions. It can be endometriosis. It can be definitely cyst. Someone said they had a complex cyst. So something like that is usually dampened phlegm and blood, kind of creating a little bit, or like a small stagnation. The one that kind of, if we go down to blood and chi stagnation, first, let me say about dampened phlegm. If that is the pattern that you feel like, oh, I think I'm maybe in that pattern, if I have cysts and I have endometriosis or PCOS, the tongue will often be kind of puffy, pale, with a white or yellow coating. It can be red too, though, but there will be some element of dampness, which is like a puffiness or a thicker coating. The blood and chi stagnation is often present when there's any underlying inflammation or pain. So if you have pelvic pain, if you have painful periods, if you know you have endometriosis, then you're more in this category. If your periods are regular, you don't have a lot of pain, then you're more up here in the kidney category, probably. Okay, so I'm going to pause and just type in to the chat what category you think is most prominent for you, taking into consideration that you are going to have likely some element of all of these, and some of you will be like, I'm in every category, like I'm a mess. But try to identify which you think is underneath the other issues. So it's often some type of kidney deficiency, and either or damp or blood and chi stag. Those are like the most common. And then of course the liver and spleen can be in there, but kidney. Yeah. What would UTIs come under? Kidney. Yeah. So probably damp and phlegm, someone said. Natalie says bottom two. So damp phlegm and chi and blood stag, but underneath there's probably kidney. Yeah. So sometimes we have to like really address the pain and the inflammation and like get some of that taken care of. And then underneath that, we're going to see, oh yeah, there's the tiredness, there's the fatigue, there's the so-called diminished ovarian reserve. We always, if we're working with fertility, we do need to support the kidneys underneath, even if we're clearing out some of this other stuff. So Alexandra says dampened phlegm, endometriosis, yeast, endometritis, which is an inflammatory reaction in the endometrial lining. And the endometrial lining has its own unique microbiome. So for anyone that didn't know that, I just want to let you know that your vaginal microbiome is very distinct from the microbiome of the endometrial layer. Kidney deficiency, blood deficiency, yeah, that's common. Chi and blood stagnation, kidney yang deficiency. Oh, yeah. So Lindsay said, since my miscarriage, I've been bleeding for 33 days. So remember, Lindsay, what I said about the spleen holding the blood into place. So yes, there's a kidney yang deficiency underneath that, because kidney yang supports the spleen. The spleen is like not able to do its function of keeping blood in the vessels. Lindsay, for that, moxa is really important. Moxibustion is like using herbal smoke therapy. It's like an herbal smoke therapy that warms the channels. So you can check that out. Kidney spleen. Yeah, kidney spleen goes together. Kidney damp. Yeah, so that's the kidney spleen damp situation. Yeah, so Celeste says, I think kidney, but seems like all of them have some elements for me. Yeah, me too. Like I can see how sometimes I go more into spleen and spleen chi deficiency, or how I sometimes even I get damp accumulation. I get cyst occasionally. Yeah, damp, but also spleen and kidney. Kidney yin and blood stagnation, Kidney, spleen, liver, scallop. Is a scallop tongue dampness? Yeah. So a scallop tongue is more deficiency than it is dampness. A scallop tongue lets us know that there probably is dampness, but only because there's a spleen Qi deficiency. Callie says, I think I'm in the kidneys. My cycle is super regular, not painful. Although I have spotting before my bleed, so I thought it was low progesterone, kidney yang deficiency. Oh, but I did topical progesterone and it made the spotting worse, which confused me. Yeah, topical progesterone is like, the results are varied depending on how, because when you use topical progesterone, it gets metabolized in a very particular way. So it's different than when you take it internally. It's different than when you even use it vaginally. So we can come back to that because that's an interesting one. Liver and damp, I believe. Would love to hear more about the uterine microbiome. Yeah, we can talk more about that. Okay. So I get the sense that you're getting it. So I'm really glad to hear that you're like, okay, I can see where my challenge is, like where I need to focus my energy a little bit more, because I'm going to be sharing with you kind of across the board what needs to happen.